Yes, sure. Welcome everyone to the Malone Center for Engineering and Healthcare Symposium on COVID-19 and Disparities. Um, COVID is a once in a century emergency that needs no introduction, and we thought that the disparity problem was very much talked about, but kind of understudied relative to every other emergency we're worried about right now. This event is meant to be a little bit of an experiment, I suppose, rather than just have a day full of Zoom talks, which is what these events are usually like. We're trying to make it more of a 2-day format with a gap in between, and to involve people actually working on specific projects in this space, rather than just reporting, having longer talks report on what's already been done. And so this is going to be a very exciting event. I'm very much looking forward to it. And I wanted to introduce Gregory Hager, who is the director of the Malone Center, which is organizing this event, who is going to say a few opening words.
All right. Thank you, Ilya. First, thank you for the organization work that you've done for this symposium. As Ilya said, I'm Greg Hager. I'm the founding director of the Malone Center for Engineering and Healthcare. For those of you who don't know the Malone Center, our mission is to identify pressing healthcare problems and to harness engineering innovations to address those problems. We comprise about 50 faculty. We're spread across the School of Medicine, School of Public Health, Nursing, the Career Business School, and Engineering. And while our faculty come from a wide variety of areas, they all share a common goal of pursuing deeply collaborative solutions that advance the efficiency and effectiveness of healthcare. The onset of COVID was really a call to arms for the Malone faculty. In early March, we convened a series of meetings where we had a set of in-depth discussions between clinicians and engineers aimed at identifying areas where engineering could contribute. Through the efforts of our faculty and staff, we identified and prioritized several projects to support frontline healthcare workers. These included tools to protect healthcare workers while they were testing and treating patients, decision support tools aimed at better triage and treatment of COVID patients. We developed tools that were aimed at distributing patients among healthcare locations and optimizing the allocation of healthcare resources. We also created data sets that could be used by other researchers to advance their own efforts in this area. All in all, it was really an amazing effort by an incredible and dedicated group of faculty, staff, and students to address the looming crisis. And I would invite you all to visit the Malone Center website if you want to learn more about some of the projects we've done related to COVID. While all this was going on, we also started hearing about reports on the demographics of the disease. As we all know well, there are a number of factors that increase the risk of severe disease and mortality from COVID: age, obesity, diabetes, hypertension, and so forth. But we also started to hear yet another significant predictor of disease: ethnicity. The CDC developed and maintains COVIDNet, a population-based surveillance system that collects data on laboratory-confirmed COVID-19 hospitalizations among children and adults through a network of about 250 hospitals across 14 states. And in COVIDNet, they found that in all hospitalizations, 33% were Black and 45% were white, even though in the catchment area of their data set, only 18% were Black and 59% were white. Of course, there are other data that have indicated a higher than expected rate of the Latinx population as well. I'm not really telling you anything new. We've heard all of this from many major news outlets, that there really are these very obvious disparities in who is presenting with COVID and the outcomes that they're having. So this really, as a backdrop, was where we started with this symposium. Every year, the Malone Center puts on a symposium on some topic in the area of engineering and healthcare. Typically, it's a In-person event, we draw a few hundred people, we get together, we discuss a topic of topical interest or current interest in the healthcare and engineering space. And the goal really is to raise awareness and to develop connections to advance that area. Disparities in COVID really popped up in our discussions as an area that we wanted to advance due to some of the data that was coming out. But at the same time, we obviously weren't going to be able to get several hundred people together to have a typical symposium. And that's where today's meeting, today's workshop really started. We decided that we didn't want to just learn about this area, but we really wanted to be in a position to do something about it as well. And so today's workshop really is focused on not just listening and learning, but also doing. If you look at the program, you'll see that in the morning, we've got a set of talks. So that's the listening and learning part, where we'll have people talking about COVID and different elements or aspects of the disease. But in the afternoon, you see there's going to be a set of lightning talks from data science teams. So through the efforts of our organizing committee, we have 6 data science teams that are going to be actually working on different dimensions of understanding disparities in COVID-19 through the coming week. Next Tuesday, we get together, we have another chance to listen and learn some more talks, but also we'll have a chance to learn what those teams have achieved over the past week. Before turning over the podium and starting this program, I wanted to take just a minute to also recognize the organizing committee for this symposium. In particular, I wanted to again call out Ilya Spitzer, who really was the brave soul who took on the challenge of trying to put together an online workshop of a completely different format. But he was one of a set of individuals in our organizing committee who put this together. So I also want to recognize Scott Ziegler, Ali Strauss, Diego Martinez, Casey Overby Taylor, and Jeff Sewardson, who are also part of the organizing committee and really put in an incredible amount of effort in a busy and unusual time to put together a super meeting that I'm really looking forward to participating in. And while we can't applaud the way we usually would, I do really want to give them my heartfelt thanks on behalf of all of us for their efforts and what is to come. So with that, Ilya, unless you have any further remarks, I will introduce our keynote speaker.